It's been an awful fall and even, but let's look forward at this point.
In an almost unanimous vote made public Friday, 97% of members with the Quebec Federation of Family Doctors have approved an agreement in principle with the Quebec government, changing key elements of the controversial health reform known as Bill 2. All this as the law forces the second resignation of a government minister, this time Health Minister Christian Dubé.
Unfortunately, we've lost a few family physicians in the run.
The FMOQ told City News the deal will incentivize family doctors to take on 500,000 additional patients, but drops proposed pay cuts if they fail to meet it. It also scraps patient color coding based on vulnerability and penalties for speaking out. Family doctors will also receive a 14.5% pay increase totaling to $434 million until 2028, with an optional 2.5% increase if the target is met by June. The bill's implementation is delayed to February.
We haven't had that many gains. Actually, we did not even meet the inflation over the last 5 years.
It's a sentiment shared by doctors like Mark Roper from Montreal's Queen Elizabeth Hospital.
I wouldn't call them gains.
He says the negotiations themselves have had consequences of their own. Many doctors across Quebec have already left the province leading up to the deal, among them an urgent care physician and a family doctor at Queen Elizabeth.
We're going to have 2,000 orphan patients, and one of our top doctors in our urgent clinic has left.
It underscores something he says the new deal couldn't address, that is, hiring more doctors.
We're told we have sufficient physicians in our region, but we see about 100,000 people who live outside of our region.
In order to not decrease the quality of the service that we offer, we need to be able to, when appropriate, defer to other professionals.
The agreement comes as Health Minister Christian Dubé announced Thursday that he'll be stepping down and leaving the CAQ. He said that he disagreed with several key elements in the new deal, saying that it only maintains the status quo in the healthcare system. Sonia Bélanger, minister responsible for seniors and social services, was sworn in Friday to replace him.
J'ai l'intention de travailler avec les médecins de famille.
I intend to work with family doctors in Quebec. There's a firm commitment on both sides to make care and services accessible to the Quebec population. This will be my priority. On X Friday morning, Premier François Legault said Dubé's departure was a tough blow to take. Dubé was benched during negotiations with the FMOQ last month, the deal being settled between the doctors and Legault himself. Dubé is the second minister to resign over Bill 2, following then Social Services Minister Lionel Carman in October. In Montreal, Zachary Cheung, City News.